Dr. Becky Cooper for the first lot of questions.
Yeah, thank you so much. Really interesting. Just a couple of areas of clarification, if that's all right. So the result that you said you found the most surprising, I think, was the young carers substantial income reduction. When you were running your models, did you have cause to look at why that might be the most substantial income reduction? I realised that you were modelling, but was there sort of additional information that sort of gave you an understanding as to why that is coming out as it is?
Well, for me, it was what shocked me is the £502. Like I knew they were facing a penalty, not to this extent. But I think, like, if I had to speculate on this result, I think we can really understand why, because they face the highest cost opportunity. Right? Those are the people that, instead of dedicating their time to the education, to training, to build up work experience, they provide unpaid care. And this not only affect them in the short term, but they affect them in the long run. So they will always have less experience, less education, less work experience compared to young people who instead can invest in education,
Okay, so just to clarify for my understanding, when you say it's substantial income reduction, is that you're calculating their future earnings potential, or you're looking at their sort of educational how are you calculating that?
So the penalty, the percentage that you see is the ratio between the average loss in the years that we follow, so 5 years, 6 years, compared to the pre-treatment income. Okay. So that we can actually contextualize in terms of how much they were earning even before and have a relative penalty. But if you don't want to face, if you don't want to see the relative penalty, you can check the numbers directly, and you can see that in year 3 or 4, they face a £500 less. That's the average. And yeah, I'm just referring to cost opportunity because I'm speculating what can happen. What can happen is that they are not investing in anything else rather than unpaid care. We are considering 20 and more hours of care. How can they combine education, training, work experience as the doppelganger?
Okay, so it's opportunity cost you're looking at.
Yes,
in terms of
opportunity cost.
That's clearer. Thank you. And for women, when you are looking at their substantial reduction, are you also controlling for things like previous maternity leave and other issues that sort of impact women's lives more, with sort of taking leave for other areas?
No, we are not controlling for that because unfortunately we have limitation due to data. So we try our best, but we try to find the closest doppelganger. So, for example, we control for family size. That gives us an hint on whether there is a child or not, and so whether there is previous childbirth leave. We always compare the individual to the closest doppelganger. So we're comparing two people that statistically, as possible, are very close to each other. We are not comparing different people.
Okay, so you're sort of looking for averages and then statistically comparing them. So if I can just move you on, and I appreciate that you've obviously looked at this data, and I'm not expecting you to sort of design policy here and now, but based on the conclusions that you've come to, what do you think the government should learn from this research in terms of the reforms that they should be looking at?
So I'm not a policy expert, but I will try my best. So the main result here is there is a caregiving income penalty. Now, we are investigating further with our next paper to understand what is the driving force. But if you think about it, when we take in consideration the caregiving income penalty, our variable income takes in consideration labor market incomes. So we can speculate and say the driving force is reduction in working hours, change in occupation, or leave the labor market. So I think the most straightforward things to say is that we need policies that help unpaid carers to combine paid work with caregiving responsibilities. So for example, flexible work arrangement, working from home, paid care leave, you already know that, robust support system, for example, or target financial measure. So I was hearing before the lady here, she was mentioning the criteria for the carer's allowance. It's unbelievable there is still there is a limit for people who are into education. This affects young carers so much. And I think another conclusion is, because it's so diverse, we need really a target policy. We need to take in consideration that people do face this penalty differently. So, for example, young carers, policy that can help identify them immediately, to support them into the education, into the employment, and, you know, try to limit the short-run problems that they face to them. Yes,
no,
sorry.
I mean, that sounds completely sensible to me, absolutely. And as you say, the data back up what we perhaps we might talk about and say, well, it's obvious, but these data make it incredibly clear. Just one more quickly from me. In your appendix, and I know you mentioned it, there's the ethnicity comparator, and I know that you sort of didn't go into detail on your presentation, but I just wondered if there were was anything significant that you wanted to highlight with the ethnicity comparator.
So I think that what is significant here is that we need to investigate more, because I'm a little bit ashamed of the classification that we were able to do because of the data. Right. We only divide in white and non-white, and I think we are losing out so much variability in here that is not a good distinction. But we wanted to give a little bit of a flavor of what could happen. I think what we see here is that white face the biggest penalty, but the explanation is that also white, what we categorize as white, do have higher pre-income prior to the treatment, so quite expected. So that's why I didn't show, but this is something we are investigating further, 100%.
That's really useful. It sounds like there's a whole lot more research to.
Yeah,
Thanks so
absolutely,
much.
On ethnicity, yes.
Great, thank you.